Hello, everybody. Thanks so much for joining us for a special interview today. I'm Tracy Kennick, and today we want to talk a little bit about the recent outbreak of measles across the state of Texas. Since February of this year, the United States has experienced a significant measles outbreak, primarily affecting Texas and New Mexico, with additional cases reported in New York. Texas now has over 300 confirmed measles cases, including one death of a child. That child in West Texas was unvaccinated but had no underlying health conditions. There was also an infected adult in New Mexico who died from the virus. So today we've invited the director of our public health department, Mr. Kenneth Coleman, to come on and talk a little bit about the growing number of cases here and what we can do to protect our children. Thanks so much for being here. It's an important topic.
Glad to be here.
Right, we want to make sure that our community is safe. So first off, tell us a little bit about measles for people who don't know about the virus.
Measles is a highly contagious virus that lives in the mucus and the throat of an infected person.
Mm-hmm. And people think sometimes it's just a cold or a rash, but there's a lot more to it.
Yes, the thing about measles is that it could be 7 to 14 days that you can be infected with measles before symptoms appear. So you're most infectious 4 days prior to the rash appearing and 4 days after.
And it's super contagious.
Highly contagious in the fact that if one person in the room had measles and you're in a room with 10 people that's unvaccinated, 9 of those people will test positive for measles.
How do you get it? Like it's touching a surface, or if they cough on you?
It's air droplets through the air, but they linger and they can land on surfaces that, and they can live as long as 2 hours in the air once the infected person leaves the room.
Wow. So you might walk into a room where an infected person had been and become infected, and not even without them being there, right?
Correct.
Okay, tell us what the symptoms are, how you can...
The symptoms are you first would notice a high fever, 104, 103, 104 range. You can have a cough, a runny nose, or you can have watery eyes. But here in Southeast Texas... That's
my allergies every day.
Exactly.
Itching my nose and my watery eyes, right?
And then 2 to 3 days after those symptoms appear, you may notice white spots on the tongue inside the mouth. Then after that, 3 to 5 days after that, then most people will notice a rash. And most people, that's when they realize something is wrong, that they see the rash. But think back now, it's been 7 to 14 days since you've been exposed to measles. So you've really been exposing the unvaccinated to this highly contagious virus by the time you see the rash appear.
So what makes it so deadly?
It's because it's so contagious. Mm-hmm. And it shouldn't be deadly simply because there's a vaccine to prevent it.
Right. So what is it that has taken, like this child who passed from it, if it sounds like a cold or like allergies and you have a rash, but does it affect the lungs, or what part of the body is it?
Well, in the cases in West Texas, most of the people that's presenting to the hospital, mm-hmm. it's either dehydration or respiratory distress.
Okay.
And so it can cause pneumonia. Oh. So in a child, that can cause difficulty breathing. And so most people, once they start experiencing the dehydration or the respiratory distress, then they seek medical care.
Okay. And as you mentioned, it is fairly simple to prevent it because in almost every one of these cases, they were unvaccinated.
And just to highlight that, back in 2000, measles was officially declared eliminated in the United States due to the high vaccination rates.
And that's the MMR shot,
That's
right?
the measles, mumps, and rubella.
Okay.
And you're required to have 2 doses. Your first dose is between the ages of 12 to 15 months, and your second dose is aged between 4 to 6 years of age. And so with the vaccine, it's 97% effective of preventing someone from catching measles.
But, and this is the big but, is a lot of parents are choosing not to have their children vaccinated. Why is that?
It's a lot of hesitancy with vaccines, and that hesitancy has grown post-COVID. And so we're having more and more parents who are opting out of getting their children vaccinated because there's a lot of misinformation out there about what vaccine cause, so forth and so on. And it's very, very disheartening. And so in light of having the death of a child in West Texas and the death of an adult, that should alarm us and to just remind us how serious measles is.
And there's several ways that you can get that exemption, right?
In Texas, you have a medical exemption, you have a religious exemption, and now you have what they call a country interest exemption, and that's just a matter of conscience. It's just a matter of a parent decide they don't want their child vaccinated. And that is growing. More and more parents are opting out with these exemptions, and it's a simple process. You go to the state website, you download an affidavit form, you fill it out, you get it notarized, you submit it back to the state health department, they review it, and that exemption is good for 2 years. But again, we seeing kids die from measles, and we haven't had a death in decades in America from measles. So, I read this quote, it's a simple process with dire consequences.
How do you feel about exemptions? Do you think they should be allowed and legal?
I don't think they should be. Medical exemptions, of course. People with compromised immune systems can't take the vaccine. Pregnant women can't take the vaccine, right? So we understand medical exemptions. But when we talk about just of a matter of conscience, just because of a lot of misinformation going on, that impacts the community. It doesn't just impact you, that impacts the community. Because as we see the situation in West Texas, it started with one case. And then it spread. So community immunity is not just a person's choice, right? It's a collective responsibility. And we have to take care of our community because we do have people that's in our community and even in our own families who can't take the vaccine.
Right. Now, in light of the fact that there was an adult who passed, some adults may be saying, oh, do I need to get a booster? Or if I was vaccinated as a child, am I good? And if I haven't been vaccinated, is it too late if I'm an adult?
According to the CDC, if you've had both doses, then you're protected. Now, of course, if you're unsure about your vaccination status, I would highly recommend that you get vaccinated. It's not going to hurt. Even if you had it, you just don't remember, don't have any documentation, it's okay to get it. So it's never too late to get the vaccine.
Now, as from one director here in the city to another, I've seen you in these meetings and you're passionate about this. Why is that?
Because public health is my passion. And it's worrisome in the public health community that we have people who follow all this misinformation, and vaccines has been proven over decades to be effective. And it's so disheartening, it just breaks my heart that this family have lost this child and this adult. So we have families that are suffering right now from the loss of a loved one that didn't have to be.
All right. Anything else you want to tell people about the public health department and how you're able to help?
Well, we here in Beaumont, we want our public health department to be the trusted source. We want you to call us, right? This information that I'm talking with you about, we share this on our Facebook page. We also have an X account. So we just ask people to follow us on Facebook. And we'll welcome all your phone calls, any questions that you do have, and that's what we're there for.
All right. Thank you so much, Kenneth, for coming on and for all you do for the city of Beaumont. Appreciate you being here. And to find out more information on the measles outbreak, and as Kenneth mentioned, other health information, be sure to check out the City of Beaumont's website and our Facebook pages. For now, though, I'm Tracy Kennick. Thanks so much for joining us.